Depression, recognizing signs and symptoms.
Well, to me, it's like being pressed down, like a weight on you all the time. Very, very hard to get along with yourself.
This is how 93-year-old Robert Creeling felt during his depression after the loss of his wife in 2006 and the loss of his beloved stepdaughter who died soon after that. However, he now rarely experiences those depressed feelings and credits his happier moods to his home care worker, Nettie Koba. She's been with Robert for the past 3 years. Nettie's compassion and cheerful personality lifts Robert out of his sad moments, and he looks forward to her arrival every day. Nettie makes him happy.
She makes me smile. I enjoy her. I say she's my family. I see her more than anybody. And as I say, she's very easy to talk to. She's very easy to get along with. I have a lot of affection for her.
Nettie understands that Robert is lonely and knows how important it is to keep him busy with the things he likes to do.
He bought a computer, he started playing games. There are a lot of things we did here just to keep his mind out of depression. Yeah, we bought a computer, we bought this, then we went to the coloring books, we went to the stamps, we went to the coins.
She also knows that it's important to line up projects for him to do once she leaves. This occupies his time, makes him content, and has lifted him out of his depression. Nettie's seen a change in Robert once he found things to do that interested him. And Robert credits Nettie as the reason he no longer feels depressed.
Well, I ask her to be herself. I can't be depressed with her. It's true. She's very happy. She's very easy to get along with. If I want to laugh, all I do is tell her something about a boyfriend or something of hers and get her laugh. We get along very well. If she wasn't here, I could easily get depressed because I'd be no one to speak to.
Depression can be a serious medical condition and sometimes requires medications. In all cases, though, a home care aide like Nettie is critical in treating depression. Dr. Jules Rosen is Chief of Geriatric Psychiatry at the University of Pittsburgh Medical Center.
Nettie is a terrific example of how a human being becomes the most potent, not just antidepressant, but prevention of depression. Robert hopes to see Nettie every day that she comes. And you can see it in his face, you can hear it in his voice. She is so important to him. Without Nettie, Robert would not be the same person. And in all of your cases, your home care clients look forward to your showing up. Sometimes they may not show it, okay? They may be irritable, they may be grouchy. On some level, you are so important to them, and you are a lifeline in many cases, and you will prevent their depression or treat their depressions.
Depression is very common in people receiving home care, whether they're younger or older. And serious depression, also known as clinical depression, is twice as common in people receiving home care compared to other people living in the community. For some people, depression is an illness they have struggled with at different times in their life, and there does not have to be a specific cause. But for consumers of home care services, there may be many environmental and social causes of depression.
Beautiful.
Is the director of Community Care Center of the Northeast in Philadelphia.
Yeah, and depression can be an anniversary date of a loved one who just died, or it could be maybe it was a child that it was their birthday, and they've lost a child, and that comes back to us. Maybe it's a matter of their finances or money's going. There's so many factors in the senior population that causes depression, and we deal with it all the time.
There may be particular times in your clients' lives when they are more depressed than other times. They may lose a spouse. It may be the anniversary of the death of somebody they loved. And sometimes they'll want to talk about it, sometimes they won't. You can observe, you seem a little down today. Anything you want to talk about? Open the door. You don't push them, but you just open the door and let them know you want to hear. Holidays may be particularly difficult. They may remember Christmases or Thanksgiving gone by when all the family was there in the good times, and it may make them feel very sad. You can ask them, but if they're remembering other Christmases, and acknowledge this must be a very hard time for you. And then do something special. Make a special Christmas basket or a special Christmas visit that makes this a special day for your client. And it may help, it certainly won't hurt.
Marion Hollabaugh won the Pennsylvania Department of Aging's Direct Care Worker of the Year award.
Some clients, when they're depressed, they want to sleep a lot. Sleeping is the main thing with people with depression. They don't want to get out of bed. They don't want to eat. They don't want to talk. And, you know, and if I see that, I'll ask them if there's something bothering them, you know. And sometimes a client will tell you, you know, that something's bothering them and they're depressed. And basically, sometimes just talking to a client and understanding gets them out of their mood, that they have somebody that they can talk to and listen to them and make them feel better. But if it keeps on, then we have to notify the agency, and so they can get some help for them.
Rolf Trainer was an athlete. He loved to play baseball until a disease caused him to become disabled in his early 20s. Rolf has battled depression from time to time.
Oh, absolutely. I mean, a loss is a loss. You lose a loved one. You go through those certain stages. Same way with a loss of capabilities to a degree. It's only human. And to say that I didn't have depression would not be true. Everyone experiences depressions in their life in one way, shape, or form. How we go about addressing them, again, is personal choice and so forth. Some of the events that have occurred in my life, I've sought professional help with, because I didn't know the answers. I didn't know where to turn to. And by professional help, it could be anything from your minister to a good friend to someone that is a counselor or psychologist.
Jack Silverstein has had his share of health issues, including dealing with severe diabetes for 45 years. He has also battled depression.
It got to the point a lot of times where I really felt worthless. I felt, well, why am I here? I mean, why should I be here? And that's when you need help.
Jack's wife Donna noticed a big change in her husband when he became depressed.
He was always get up and go, got up and went and everything. And when he didn't want to do anything, when he lost interest in life, and there was plenty of times he didn't want to do a darn thing.
Although Rob Oliver gets depressed infrequently, it does hit him once in a great while. He was 21 years old when he was in a terrible surfboarding accident that left him paralyzed for life. Rob is now married with 8-year-old triplets, and while he does not see himself as a depressed person, on a rare occasion, it does hit him hard.
Once or twice a year, I have what I call a crash day. And those are the days when everything goes wrong and you just realize this stinks. It stinks that I have to have somebody come in and help me get dressed. It stinks that I can't, throw a football with my kids. It stinks that I can't put myself to bed. It stinks that I make an arrangement for a schedule. And I mean, think about this. I'm getting up in the morning and my attendant is here early in the morning and, starting at sometimes 5:30 or 6 o'clock. And then I get up and I get dressed and I eat breakfast and it's straight out the door to work. and there's no time to really get anything done. You sit in traffic, you work all day, you sit in traffic, you come home, you eat dinner, you help the kids get their bath, you help the kids get their homework done, and then the next thing you know, your attendant shows up, and like, there's no personal time in there, there's no time to get anything done, and it's just like, yeah, this stinks. But then you start to look at it and say, okay, maybe I can't throw a football with my kids, but I am still an active part of my kid's life. And that's really what's important. And you've got to take a look at what it is that you do have. And when you understand that, at least for me, it helps to get out of that this stinks mode. It helps to really be appreciative of the fact that I'm alive, I can live life as fully as possible, and I'm still engaged with daily living, and that's what's really important.
Luckily for Rob, his depressed days are rare. At times, it can be hard for a home care worker to distinguish between what is true depression and what is just a consumer having a few bad days. Here are some of the symptoms that you should look for.
What are the symptoms of depression? Well, first of all, many times, but not always, you'll see a sad mood or a negative mood, irritable, angry. You don't always have to have a bad mood to be depressed. You may also see loss of interest. The things that they used to enjoy doing, watching the ball game, reading a book, no interest at all. So sadness or loss of interest are the key symptoms, and you don't have to see both. Then you're going to see other things. For instance, there may be a change in the sleep pattern, too much sleep or too little sleep. There may be a change in their energy level. I have no energy today. I can't get out of bed. There may be a feeling of worthlessness or hopelessness. What's the use? I can't do anything. I'm a burden to you, to my family. There may be a change in their appetite. Most often there'll be a loss of appetite. In some circumstances, they may just start eating constantly. Now, if you see these changes, this might be depression, or they may have a physical illness. They may have an infection. If they have diabetes, their blood sugars may be out of control. So these symptoms don't mean the person's depressed.
These symptoms may or may not be depression, but if they last more than 2 or 3 weeks, there is a good chance that it is what we call a major depressive episode. If it is depression, it can become life-threatening. Some intervention is needed. Some kind of therapy, additional environment support, or antidepressant medications can all be helpful. The consumer failing to receive some kind of treatment can lead to disastrous consequences, including poor nutrition, loss of motivation and mobility, pressure ulcers, and it can even lead to suicide. If the consumer talks about suicide, you must alert your supervisor immediately. And what should you do if you observe these symptoms of depression?
Number one, talk to your consumer. How are you feeling? Not so good. What's wrong? Engage them in the discussion. Are they feeling down? Have they lost interest in things they used to enjoy doing? Is there something going on in their environment that's upsetting them? Maybe they're disappointed their grandchildren couldn't come visit. Explore with them. Number two, engage them in the activities that you know usually brings them pleasure. Let's put on some music together while I'm here. Let me bring you something to eat that I know you enjoy eating special. Do the usual things that brightens up the day of your consumer. If none of these work and you're concerned that this person is sliding into a depression or perhaps something else is going on, at that point you report it to your supervisor. If it's okay with your consumer, you might say, is it okay if I discuss this with your daughter? Maybe she can help make you feel a little better. Again, that has to be with your consumer's permission.
Rolf has some suggestions for home care attendants.
I would say if that attendant senses those things are going on with that individual that they're working with, communicate. Communicate to the point where you're not invading their privacy. It's almost impossible, if you're a good attendant, not to humanly care about that individual. But you also have to remember they have their dignity as well. They may choose to stay withdrawn about certain things, allow them that space and so forth. Again, your job there is to provide them certain assistance according to what their needs are. That's pretty much it. It's a fine, tap dance you have to do sometimes. But again, I see no problem with you communicating to that individual that these are some of the things you've been experiencing.
And Rob's advice? Pay attention to changes in the consumer.
I think that, like, the level of communication, if somebody is, exceptionally quiet, so anything that changes out of the normal status quo, so to speak, that when somebody is doing something abnormal, there's a change going on there. And when something like that happens, looking for changes in appetite, changes in sleep patterns, those kind of issues are going to be tips to say something's not right.
If the consumer is depressed, they may require therapy or even medication. But the good news is that with the proper treatment, the success rate is very high. But as a home care aide, you can play a vital role in helping them with their depression.
Home care attendants can be the best antidepressants in the world, better than any medication. Whether you think your client is depressed, or if you think they're just kind of are lonely or down in the dumps a little bit, your behavior can brighten their days, and you can be the best treatment of depression. What is it that you can bring to this person? Well, number one, you bring your happy face and you bring your caring and your compassion. Number two, you bring a human being into their lives that they may not otherwise have. And for most people, that is a terrific antidepressant.
Again, here are the signs of depression that you should watch in consumers. Sadness, loss of interest, change in sleep patterns, low energy, feelings of worthlessness, helplessness, and hopelessness, changes in appetite.